Good morning. Thank you all for coming today to the regularly scheduled meeting of the Board of Multnomah County Commissioners. Today is Thursday, August the 20th. The health and safety of our community and staff members are at the forefront of our minds as we continue to navigate county business in the light of the COVID-19 pandemic. In accordance with the declaration of emergency announced on March 11th and extended by the Board of County Commissioners on July 2nd, today's meeting is being held virtually. To align with physical distancing guidelines, some rules associated with Board of County Commissioner meetings will be temporarily altered. Today, we will be suspending public testimony on any non-agenda items, and written testimony on agenda items has been accepted via email. Please mute your mic when you are not speaking, and when you're presenting, make sure to unmute your mic and check to see that your camera is on. Thanks again for coming this morning, and Commissioners, may I have a motion on the consent calendar?
So moved.
Second.
Commissioner Vega-Peterson moves. Commissioner Stegman seconds. Approval of the consent calendar. Marina, will you now take a roll call vote?
Commissioner Vega-Peterson?
Aye.
Commissioner Stegman? Aye. Chair Kafori?
Aye. The consent calendar is approved.
R1, Black Breastfeeding Week Proclamation.
May I have a motion?
So moved.
Second.
Commissioner Stegman moves. Commissioner Vega-Peterson seconds. Approval of R1. Good morning. Who is up first?
Good morning. Charlene, are you able to unmute yourself?
You want me to unmute myself?
Sure, maybe not. We'll just get started without her for now. And
Can you hear me? Can you hear Shirley?
no, Shirley, I said Charlene.
Oh, sorry.
And Charlene is texting me saying that the host needs to unmute her so she can speak. Marina, are you able to unmute her?
Yep, she should be in the meeting now. Thank you.
Thank you.
Good morning, Charlene.
Good morning, Chair, and happy birthday.
Thank you. Thank you.
So good morning, Chair Kafori and Commissioner Stegman, Vega-Peterson, and Myron. My name is Charlene McGee, and I serve as your REACH Program Manager. Today, I'm honored to be a part of the recognition of the 7th Annual National Black Breastfeeding Week, along with members of the REACH team, Health Department colleagues, and community members who will join today's panel. Breastfeeding is liquid gold and serves as a protective factor against chronic disease and promotes the health for mother, baby, in our community. An African proverb reminds us that it takes a village to raise a child. Breastfeeding is everybody's business. We invite you as decision makers and employers to join and support REACH efforts to normalize Black breastfeeding and disseminate our campaign materials, Feed, Nourish, Love, through your newsletters and social media posts. We invite you to join the movement to build a culture of Black health in Multnomah County. With that, I'll turn it over to Ms. Helen. Thank you.
Heard again, Chair, Commissioners. Can you guys hear me well? Okay.
Yep. Good morning.
Good morning. Thank you again for allowing us to be here today and to discuss a topic that's near and dear to my heart as a mother who's breastfed my child for 13 months, and providing us the opportunity to share what REACH has been working on over the past several months. So what is REACH, and why do we care about Black breastfeeding? So REACH focuses on 3 main domains: physical activity, clinical, community clinical linkages, and nutrition. And within the nutrition domain, one strategy includes increasing continuity of care and community support for breastfeeding. REACH hopes to increase breastfeeding rates in the Black community, ensure that our Black babies have the opportunity to sustain long-term positive health outcomes as a result from being breastfed. So we've been working diligently to respond to community feedback and recommendations. Some of the work that we have successfully implemented includes a mobile breastfeeding tent, a breastfeeding campaign photo shoot. We were able to successfully advocate for a lactation space at the Rockwood Rising Market Hall. We hosted a men's barbershop talks around the topic of breastfeeding. And we are this month doing some radio and video public service announcements. In addition to this, we've also hosted a series of webinars for the month of August, which is National Breastfeeding Awareness Month. So our future planned events include, much of this year's work has been focused on community awareness and including a focus on maternal education, father involvement, and destigmatizing breastfeeding, and increasing access and awareness around breastfeeding. This upcoming year, we're going to be shifting focus a little bit, and we're going to be doing more around, specifically on employers and policy, systems and environmental changes. One of those initiatives includes an implicit bias bill, which focuses on healthcare providers, which we are considering drafting for the Oregon legislature. So a little bit about the implicit bias bill that we're going to be spearheading this year. The idea for the implicit bias bill was sparked by the state of California. Its recent passing of a similar bill, Senate Bill 464, and the bill was an effort to address Black maternal disparities. The bill would require hospitals providing perinatal care, alternative birthing centers, and primary care clinics to implement an evidence-based implicit bias program for all healthcare providers involved in the perinatal care for patients within those facilities. So the REACH team is hoping to affect really long-lasting positive change and change that we hope to see well past the lifetime of this program. Next slide, please. Great, thank you. So we're fortunate to have many great community partners that stand beside us as we work towards reducing Black health disparities, including Healthy Birth Initiatives, which provide Black mothers with culturally specific support needed to feel mentally and physically well. We have the Black Parent Initiative, who are amazing partners, the Sacred Roots doula program, which provide mothers, families with consistent care, reassurance, comfort, and encouragement. The City of Gresham Redevelopment Commission, which have been partners in advocating for the lactation space at the new Rockwood Rising Market Hall. Our local Black barbershops, including Influential, Champions, and Infinity, all located on MLK, who have partnered with us in our efforts to engage Black men in the breastfeeding journey. Our Co-Africa House, who have partnered with us to host focus groups to address challenges that face immigrant Swahili and Somali-speaking mothers in their transition to this country. The Urban League of Portland, who has been working beside us to connect and engage the Black community and members around breastfeeding and the importance of it, the practice. And then last but not least, the Multnomah County Library and BCLA, which is a Black cultural advocates group. And they've been solid partners with us to help connect the Black community to increase access and utilization of the Multnomah County Library. Next slide, please. Awesome. So this beautiful tent here is our lovely lactation station, and it was born out of the desire to provide mothers with the option to feed their children in a comfortable space, right? So like not in a bathroom or a hot car or uncomfortably dealing with people staring at them, right? Our lactation station debuted Juneteenth last year, 2019, and it's made appearances at different community events all throughout the county. Next slide, please. So late last year, we were able to successfully engage Black breastfeeding moms to participate in our breastfeeding photo campaign. We took some photos, we heard their stories, we've been working to incorporate them to our overall campaign this month. So these images will appear as a part of our campaign on buses and bus stops. And I'll talk a little bit more about that here shortly. Next, please. So the work we did at the Rockwood Rising is by far one of my favorite successes of this past year. The City of Gresham Redevelopment Commission partnered with the REACH program to successfully advocate for a lactation space at the new Rockwood Rising Market Hall development. So after some effective conversations and a formal letter that we drafted recommending a lactation space and really outlining all of the benefits of breastfeeding for moms and for people who are working in the Rockwood Rising, The developers, RKM Development, agreed to redesign the market hall to include a space for mothers to feed, pump, and rest. Next slide, please. So these images here, the Barbershop Talks was another great success. Reach partnered with prominent barbershops that I mentioned earlier in our community to bring 35 Black men ranging from ages 18, so first-time fathers, all the way down to 70 grandfathers and great-grandfathers together. And we discussed their general thoughts, their attitudes, their feelings, and knowledge and experiences around breastfeeding, and you know, how they could support the journey for mothers. Next slide, please. So the concept of Barbershop Talks was really developed from recognizing the important role that men and partners played in the breastfeeding journey. As a matter of fact, substantial evidence suggests that support from men, partners, and family members can actually result in sustained long-term breastfeeding. One study specifically stated, quote, men's contributions to the breastfeeding relationship can help overcome the lack of structural support. Some of the themes that we found in our shop talks include need for cultural and institutional support, resources on ways that fathers can engage with the practice, and concerted and culturally specific education on the importance of breastfeeding. Our breastfeeding shop talks was a huge success. Next slide, please. So this is what I was referencing earlier. In our efforts to reach the masses, reach advertising to display several of our campaign photos on TriMet signage. For this campaign, we utilized the Center Garage and Powell Garage bus coverage routes with a total investment of 63 bus displays and 10 bench locations all throughout the county, from North Portland all the way through Gresham. The campaign photos are set to be installed in a couple of weeks and will run for a period of 4 weeks. So make sure you all look out for those ads. With that, I will pass it along to my colleague, Kiera. Kiera, take it away.
Thank you, Ms. Helen. Hello, good morning, Cherkaforian commissioners. My name is Kiera Rodella for the record, and I'd like to briefly share some important numbers related to breastfeeding trends nationally and locally. These numbers inform the work that REACH does and highlights why institutional and community support is needed for our Black mothers to successfully breastfeed. High breastfeeding initiation rates show that most mothers in the U.S. want to breastfeed and they start out doing so. And according to the Center for Disease Control and Prevention, the 2020 breastfeeding report card shows that 84.1% of infants born in 2017 start breastfeeding, while 58.3% are still receiving breast milk at 6 months. Oregon's breastfeeding rates are higher than the national average, yay Oregon, with 89% of moms who initiate breastfeeding and 72.5% who are still breastfeeding at 6 months. However, despite the recommendation to breastfeed exclusively for about the first 6 months, infants born in 2017, only about half of them nationally were still exclusively breastfed at 3 months, and that drops down to 25% who were exclusively breastfed at 6 months. Again, Oregon's numbers are higher, so what you'll see in Oregon is at 3 months, our infants are exclusively breastfed about 65% of the time, and at 3 months, about a third of the time. Next slide, please. When we look at our breastfeeding rates specifically for Multnomah County, these numbers come from Oregon PRAM's data. We find that our Black mothers initiate breastfeeding at about 92% compared to their white counterparts, but that drops about 13% at 8 weeks, whereas white babies are only drops about 5 to 8%. Next slide. And then if we are looking at exclusively breastfeeding, only about 54% of Black moms are exclusively breastfeeding at 8 weeks compared to about 70% of white moms. These rates suggest that mothers may not be getting the support they need from their healthcare providers, family members, and employers to meet the breastfeeding goals. And REACH's community engagement over the past year through our barbershop talks and community discussions with mothers and lactation support professionals reiterated that point. So So now I would like to pass that on to my colleague, Nurse Shirley.
Good morning, everybody. Good morning to the commissioners. Thank you for having me this morning. My name is Shirley Paul. I am one of the registered nurses who visit Black moms and their babies with Healthy Birth Initiatives. And this is one of my passions. I've breastfed both of my babies for over 2 years each. And I know how breastfeeding can be wonderful for babies. Unfortunately, there are some historical complication and implication that makes it difficult for Black women to breastfeed. And those things can trickle down from generation after generation. And the first one is enslavement. And nobody likes to talk about it, but it really does change the dynamic of a person's life and the community's life. And there was a time when our bodies didn't belong to us. We basically built America and nourished America. We had to nourish the babies of our enslavers who would turn around and enslave us and our own children. And that really makes you not feel comfortable with your body. Afterwards, once emancipation happened, Black women were hired as milkmaids for very little amount of money, which means while they were paid to breastfeed white women's babies, they didn't have the time or milk supply to also breastfeed their babies. So that meant that a cousin or sister was probably breastfeeding their babies. And we know breastfeeding is not just about nourishment. It's about connection with your baby, that connection that you get with your baby that lasts a lifetime. Of course, once we know how racism works, and one of the ways racism works is to make you feel less than. And in order to make you feel better about yourself, then you have to try to achieve the same level of acceptance as white women. And in the 30s and the 40s, there was such great push for formula for Black women saying, hey, if you use formula, you can be as cool or almost as equal as a white woman, because it was a status to be able to feed your kids formula. Go figure. The other thing also is the fact that a lot of time Black women get reported to CPS while they're in the hospital. So you're in the hospital, you just gave birth, your body feels like it's gone through stuff, and you're trying to, go to the bathroom. They're telling you have to pee before you can go home. They're telling you, do you know how to put the diaper on? And in the midst of that, here comes the CPS worker. This is one of the most traumatic things that can happen to anybody, but for Black people, it is very traumatic, because we are also in that sense have the worst outcome, because we're more likely to have our children removed by Child Protective Services. So this kind of fear can actually cause a woman's milk to dry up. It can make it difficult for a woman to bond with her baby. So that's another historical, it's not just as historical, but also in a present problem. Also the hypersexualization of Black women's body. We've heard several times from studies that Black little girls are hypersexualized really early on in life. So depending on what kind of hairstyle she puts, or if, God forbid, she put on a lip gloss. So because of that, a lot of Black women would tell you, I feel like if I put my baby to my breast, people will think it's something sexual between me and my baby. Or men will think it's something, there's something sexually deviant about what I'm doing breastfeeding my baby. And so that's another barrier for Black women breastfeeding. So where your mom will or your grandma will tell you, don't do this in public. This is gross. Don't do this in public. So that's something else we need to try to make it more normal for Black women to breastfeed. Next slide, please. The good thing is that this is not all doom and gloom. There is actually light at the end of the tunnel, and it's the fact that there is the REACH program working with us. We also have BPI working, and of course, HBI has been in the community for over 20 years. And we have some great statistics to back up the work that we do. 98% of HBI clients initiate breastfeeding. That is a big number. 38% of these women are still breastfeeding after 6 months, and 100% of HBI clients receive breastfeeding education through a variety of ways. So you have the case management you get from the home visiting nurse and the community health worker, and you also have our father-male involvement program workers who are talking to the fathers of how they can support the moms on their breastfeeding journey. I am the person who facilitates the African-American specific prenatal classes and childbirth classes, and we spend a lot of time talking about breastfeeding in those classes. Every HBI staff have received advanced lactation courses, and we also have a CLC trained HBI nurse, and we also have access to IBCLC trained staff from BPI that we can refer our clients for support, and also we can also ask questions to our NFP sisters over there who have a lot of IBCLC nurses there. The challenge that clients, oh, I apologize.
No, I just want to, could you tell us what these stand for, CLBC and IBCLC?
So actually, yeah, so I corrected it yesterday, and the CLC stands for Certified Lactation Counselor. IBCLC, I can't remember.
It's international.
Who knows? I think Miss Linda knows IBCLC stands for, but I know it's Certified Lactation Counselor, but the IB, I think it's really like of a global thing, whereas the CLC certificate that only works in America. And of course, oh, somebody else knows?
IBCLC is Nationally Board Certified Lactation
Consultant.
Thank you, Ms. Kidani. And then the challenges that our clients have identified would be lack support for hospital staff. And of course, in this, we have poor statistics. We're less likely to receive adequate lactation support while we're in the hospital. Providers, a lot of these women have said providers don't even talk to them about breastfeeding as an option. Family members, like I said, sometimes your moms are the ones saying, put this breast away, there's company here. In the community, a lot of time, again, you go out in the community and people just give you the nasty look because you have your breast out. And also the work environment. We've had clients who do not have places to put their milk after they pump, who do not have adequate places to pump their milk, even though there's a law to protect them. But again, this is where systemic racism come and also hurt us. And my final comment is to say that your breasts are naturally made to breastfeed your baby. This is the only biological need of a breast, is there to breastfeed your babies for nourishment. So don't take the milk that you already produce and not breastfeed your baby to go to take the milk that cows produce to breastfeed their own little babies to give to your baby if it's possible. There is no problem giving your baby formula, but we want to give our babies the best start possible so we can have the best health outcome in the future. Thank you, everybody, for giving me the time today.
Thank you. Thank you so much, all of you. Are there other folks who are going to participate in the presentation today?
Yes, Ms. Linda.
Is she having trouble getting off of mute?
Yes.
Hello, good morning, commissioners and everyone else on this call.
Good morning.
My name is Linda Bryan Daka, and I work for the Black Parent Initiative. I'm in IBCLC, and I know we were asked, and what does that mean? It's an international, oh my God, I'm nervous. Internationally board certified lactation consultant. And the other one should be CLC, so that's a certified lactation counselor. So those are the designations that the breastfeeding professional world puts on the levels of breastfeeding education that a person can obtain. So I actually am a mother of 10 children, and I've breastfed for almost 20 years. So before I became a lactation consultant, I had that experience breastfeeding my children. So when you look at BPI, we've had a Sacred Roots Doula program since 2017. It was more of an informal program. In 2018, we started working within the community to actually partner with WIC, and we were part of ABCO, and that's the African American Breastfeeding Coalition of Oregon. So at that point, we also had mother support groups, and in conjunction with WIC at those years too. So we formally started a pilot program with the REACH program last year. And so what did that program consist of? many different things. This whole breastfeeding campaign, we've been consulting with the focus groups. So a lot of the different initiatives that have come out of WIC, we've been partnering with. We received, for our programs, we get referrals from HBI for our doula program and also for the lactation mobile services program. And I guess I should highlight that when we say mobile lactation services, we're talking about we actually go out to moms' homes. So one of the barriers that this addressed was that moms, after you come out of the hospital having a baby, first of all, some of our moms have, horror stories about how they didn't feel welcome at the hospital, certain, little issues that happen, larger issues that happen at the hospital level. So sometimes they don't want to go back to the hospital to receive, further lactation support. Sometimes it's the fact that they don't have transportation, reliable transportation to get there. The other issue may be that they're taking a bus or the MAX, and sometimes standing outside in nasty, wet weather may not appeal to you with a newborn baby. So by being able to come to moms' homes, that eliminated some of those barriers and has allowed us to help. Also, the issue of having a consultant that has your lived experience. That's very important for someone who understands the issues that you may confront as a Black woman. So our program, our demographics are Black women, African women, biracial women in our community that we are actually supplying a consultant who has that same lived experience. And so the thing that we're attempting to do with REACH is to actually help the women in our community who want to become lactation consultants, who want to become certified lactation counselors, to be able to receive the training they need to obtain that so that they can have a career path, so they can also aid the women in their community. So that's coming up this year. And we'll be helping mentor and an ongoing program with supplying needed lactation assistance throughout our community. So when you look at it, becoming a lactation consultant or lactation education itself is an expensive proposition. So being on that career path is sort of difficult for people to obtain that. So myself, as a lactation consultant, I started years ago in another state through WIC. And so that gave me the needed hours that I needed. They paid for my training. So that was how I was able to attain it. But if you talk to the average lactation consultant of other communities, you will see a different story. They're able to, at most, pay for this education. So you have to have lactation-specific education. You have to have 14 college-level courses that you have to have. You have to sit for a 6-hour international test by IBCLCE, and that's the International Board of Certified Lactation Examiners. And so these are the hurdles that you have to jump over to become a lactation consultant. And in most hospital systems will not hire a lactation consultant who is not a nurse. So community lactation services are where a lot of our women who come out of that WIC system who do manage to make it are working. So looking at that whole system, we want hospitals to invest in our women to help make sure that we can see that connection, that women who want to take that career path are able to do that and can be supported and then employed by those hospital systems that serve our women. So that is something we're also going to be having more conversations around and looking at how we can help facilitate that understanding with our hospital system. Next slide. So when we look at breastfeeding in our community, why does it benefit us to worry about what each individual woman is doing? So why do we want to be in her home? Why do we want to talk to her about breastfeeding? So breastfeeding is important for not just the individual family, but the community as a whole. It is said that because of certain conditions that breastfeeding can help prevent in our population, the population of women and children, we save about $30 million a year in Medicaid costs alone. So that number right there should be getting everybody up in arms. Hey, everybody should breastfeed. So when we look at what is it about breast milk that would encourage us to feel, that this is something that requires a campaign. This is something that requires us to look at innovative ways to interest mothers in doing something that we used to say comes naturally. Okay, so breast milk is considered liquid gold for infants. Why? Because it has so many life-giving factors. It has stem cells. It has immunological properties in the breast milk. If you look at a myriad of health conditions that it can prevent. So it's such a long list. If we talk about the mom, it can reduce breast and ovarian cancer, type 2 diabetes in women. It helps prevent osteoporosis in women. So there's such a long list, and we don't see enough, I believe, that we're trying to help mothers understand what this can do for them, and it can help prevent heart disease, so many different things that women experience in their lifetime. The more you breastfeed, the more lifetime accumulation of breastfeeding. When I said I breastfed 20 years, collectively, that's looking at 10 children, how many years did I breastfeed each child? So the more lifetime accumulation of breastfeeding that women do, the more prevention that you'll have from certain ailments in your future. So this is not just something that right then and there protects you, but it also has protection for you for your lifetime. So when we look at our babies, what protections are there for our babies? Otitis media, which is ear infections, leukemia. When we look at with our preemie and late-term babies, when we look at the protections that are afforded with their intestines, they call it NEC. So when you look at that, how the breast milk provides a barrier that prevents little tiny holes from appearing in a baby's intestines, so there's no absorption of bacteria and things like that. This can be the difference between that premature baby making it and maybe not making it in life. So we know that there is donor milk that is given to those babies if moms can't produce it, but it's it's looked at as life-saving fluid. So when we look at, okay, it shouldn't be a question of whether it's formula, whether it's breast milk. It should always be that breast milk should trump it, and that should be our first go-to. So a lot of moms are, having challenges. So if we can give support and also education to those moms to make it seem like when it's 2 o'clock in the morning and they're having a challenge, they don't look at that formula on the counter. They understand that this is something that's going to help their baby's lifetime of, building up their immune system so that it's going to prevent them from having a myriad amount of diseases. And so when we look at, that's why we're saying it saves $30 million, because if you look at how you will not have certain diseases, diarrhea in some places in the world kills babies, so we want to look at how does this prevent it? So breast milk can prevent that. So there are so many ways. If you have a national catastrophe and you're breastfeeding, you don't have to look around for a safe way to sterilize equipment. You don't have to look at measuring equipment or cleaning bottles, a safe water supply in an epidemic. All you have to do is put the baby to the breast. And it's just, is it easy for every woman? No. But we know that 99% of women can produce breast milk. And those challenges that come out, if a woman has support, in most cases, that woman can still breastfeed either fully or partially with that support. So even if we talk about to a family's budget, you're saving $1,500 a year. So even with the WIC program, mothers that receive formula can still have to spend money each month because every baby is not a standard. So some babies eat more than other babies. So families are still having to come out of pocket with buying formula. So that's a savings right there, $1,500 a year.
I'm sorry, I don't mean to cut you off. I know we have only a limited amount of time.
I'm sorry, I get so carried away. I'm so passionate. Okay.
And we have some moms that here want to share their stories, and I know one of the moms has to return to work here shortly, and I just want to make sure that we have an opportunity for her to do her part before she has to return to work. Again, my apologies for cutting you off because that was some really great information that you were sharing with the board. But I just want to make sure that we have enough time. So with that, can we transition? Dominique, are you there? I know I saw you earlier. I'm not sure if you're, are you still there?
I'm still here. Can you hear me?
Yes.
I'm speaking.
Hi, thank you for being here. You're up.
Hi. Okay, great. Thank you. So my name is Dominique Shelton, and I hope you grow up well. My phone is glitching, but feel free to cut me off if you can't hear me. So my name is Dominique Shelton. When I was 16, I got a pap smear and then was told that I would never be able to have children. The doctor laughed in my face when he told me. And when I am now 33 years old and I have 3 girls. And with my last girl, I knew it was a high-risk pregnancy from the beginning. I did reach out to a kidney specialist to help me with that. And told the job about the pregnancy. They were upset, and which made me fearful to talk about breastfeeding or where am I going to. And I worked for a nonprofit, so I didn't know my rights either. So that also brought on anxiety as well. And just a stressful environment while being pregnant. When I had the baby, I was really excited. I came to the hospital with my nursing bras and everything, and I was able to move forward with that, but then I ended up developing postpartum preeclampsia. When I originally went to the doctor's office, I went to the emergency room and I was sent home. And I went to my primary care provider the next day. If it wasn't for her, I don't know if I would be sitting here right now. She ran out to the car and told me to go to the emergency room. She called the hospital and everything because they were sending me away, even though we knew it was a high-risk pregnancy. When I got to the emergency room, my blood pressure was 198 over 117. They went into emergency rescue care, and all I can think about was, will I still be able to breastfeed? You know, where's my baby going to be while I'm in the hospital? And I ended up going to the hospital 2 times after delivery. I did breastfeed for 6 months, but I ended up stopping because I was worried about my blood pressure, worried about dying, worried. One of the medications I was on was making my heart rate low, but not lowering my pressure. So I would worry about my heart stopping or not. I would see my baby, I just would worry that it was something that I was doing. Because
Dominique, we're having a hard time hearing you.
Body respect. For me, I feel like people just stare at me when I'm breastfeeding, like kind of watch, see how I do it or something. Comfortable. Oh, okay. So I currently still have breast milk, but it's but I'm not breastfeeding because of the medication that I'm taking. And so just my doctor longer breastfeeding, that's good. And that's I can just encourage
Dominique.
Dominique, it's really hard
to feel like I'm not alone. Me advice and help me understand my medicine that I'm encouraged, and it's all anxiety to continue to care for my child.
You're just cutting in and out a lot.
You can't hear me?
No.
Oh, can you hear me now?
Perhaps.
You can hear me now?
Yes, we can hear you now.
Okay. I was just expressing how my troubles with breastfeeding has been medically related to medicine and just not from doctors. And BPI, they have it for me as far as understanding my medicine and creating a space for me not to feel alone and talk about my fears. I know fear is the driving force of me not being able to breastfeed, and that's with fear of losing my job or my job about and also my doctors with my high blood pressure.
Thank you for sharing, Dominique. I think we were able to make out some of that, not all of it for sure, but we appreciate you coming on to share your story. So thank you for that. And then next we have Courtney Gilmore. Courtney, are you there?
Yes, I'm still here.
Thanks
hello.
for coming on to share. I just want to again make us cognizant of our time allocation here. But thank you for sharing. Go ahead. Floor is yours.
Good morning. My name is Courtney Gilmore, and I am an HBI mom. And my experience with breastfeeding has been very rewarding. Throughout the entire 18 months. The main reason why I decided to breastfeed my daughter was mainly for the health benefits. I really wanted to make sure that my daughter Lucy got a fair start with her immune system, just development. And especially with formula, you can't really control what is in the formula. So especially the first 6 months, I was super health conscious. I wasn't drinking alcohol. I was more so really maintaining a healthy diet. So I really wanted to make sure that my daughter was healthy as well as I. And this has been the best experience ever with being able to provide something to my daughter that you can't buy. And then also the bonding experience. I feel super close with her. And then we also have our own moments together. She's 18 months now, and I'm still nursing her twice a day. It's a little difficult. She wants to do a little bit more than I would like because I'm working from home now. But I wouldn't have been able to do this without HBI and that Black Parent Initiative. So I just also want to give a shout out to Linda because she helped me out a great deal at the hospital. So, and thank you for having me here today.
Thanks, Courtney. And then, so with that, we go into the proclamation piece. I don't know if there's any, I don't know what this looks like, but I'll hand it back over to you, Chair Kafori.
Great. Well, who is going to read the proclamation? Helen, are you going to read it?
Michelle.
Okay.
Yes.
Great. If you want to read the proclamation, and then we'll have board comments and take the vote after you're finished. Good morning, Michelle. Thank you for joining us.
Thank you guys for having me. Whereas Multnomah County is committed to reducing infant mortality and improving the health outcomes of Black mothers and babies through respectful community clinical practices and interventions. And whereas August is National Breastfeeding Month, an initiative designed to celebrate, support, and promote awareness of the benefits of breastfeeding. And whereas Black Breastfeeding Week is an initiative intended to celebrate and encourage Black women to breastfeed. And whereas racial inequities in breastfeeding rates persist and are the result of barriers in healthcare, employment, and community settings, as well as racial and ethnic discrimination. And whereas Multnomah County recognizes the physical and mental benefits of breastfeeding for both babies and mothers, as well as the importance of reducing racial disparities in healthcare and birth outcomes for babies. And whereas promoting diversity in the lactation field and applauding the work of community breastfeeding champions is very important, and Black Breastfeeding Week provides the opportunity to encourage government agencies, community-based organizations, and academic institutions to share this message and work together to engage in equity efforts to their communities. The Multnomah County Board of Commissioners proclaims August 25th through the 31st, 2020 as Black Breastfeeding Week in Multnomah County, Oregon, in recognition and celebration of the importance of Black breastfeeding in our community. Adopted this 20th day of August 2020.
Thank you, Michelle. There's got to be some good luck in that, right? August 20th, 20. I like all those numbers. Great. Well, I think now is the time we're going to have some comments and questions from Board of Commissioners. So we're going to start with you, Commissioner Vega-Peterson.
Thank you so much, Chair. And thank you, everybody. I was writing down everybody's name, but there's so many of you. But I just really appreciate all the work that is being done through Multnomah County with BPI, and with so many different community organizations to really do this outreach that's so needed. It's just hearing everything about this program and your experiences makes me so happy because this breastfeeding is so important. It's such a personal experience, and but in a lot of ways, it can be such an isolating experience when you're a new mom and you're not, everything's new, and you're dealing with all these weird things happening with your body, and then you have to like take care of this new life. Ms. Linda, I appreciated your explaining the program, and really especially the part about going to women's homes where they are. I actually did that after my first. After I had my first child, because I was struggling, and I had been trying everything and had all this set up with like the boppy and the pillows and everything. And the first thing that woman did when she came into my house was like, just getting rid of all these pillows and just like you and the baby. Let's focus on you and your baby. And I think just having someone to like has that confidence and just can be there for you in the way that you need is such a powerful thing. And I really love all the work that's happening with the lactation stations and the work with the fathers, which I think is just incredible. Like there is such powerful work happening here that it's something that's great to see, and it's something that we really need to keep supporting because the lifetime benefits for the mother, for the child, the way that normalizing breastfeeding in communities is really the effort of the village. Like you were saying, all of that is true, and all of that is at the heart of the work that you guys are doing. And Shirley, I really appreciated the discussion that you had about really the impacts of stress, the legacy of systemic racism and sexism, and the impacts that has on breastfeeding, especially for Black mothers, and I would say for Latinx mothers as well. Like I think these are things that like just make it that much harder, and that having people from your community, from your culture, who are there to share that experience with you is the most impactful way to really to address these issues. So this is fantastic, and I'm so happy to support this proclamation today.
Thank you, Commissioner. Commissioner Stegman.
Thank you, Chair. This was such an incredible presentation. One of the privileges of being a county commissioner is that I get to learn so much about what's going on in our community, and at such a deep level, and to learn the horrible history of breastfeeding for Black women is just unacceptable. And the fact that we are trying to address those inequities heartwarming, and I'm hopeful that we can even do better. Charlene, thank you so much for the work that you do with REACH. I know that you're out here all the time in East County, and I love a couple of you, have referred to breast milk as liquid gold, and I think that is an apt and appropriate name for it. So many things that I can think about. I did get to tour the Rockwood Rising redevelopment. And I toured the first building, which is the WorkSource building, where people will go to get their unemployment. And there actually was a breastfeeding room that was identified. But that's in addition to the marketplace hall that you all were talking about. So you guys are making a huge impact in communities that need culturally specific services. So great job on that. And I'd be remiss if I didn't mention the Census, because the work that you do is funded by the Census. We need Black and Brown communities who may have fears about filling out the census, but it is safe to fill it out. That information is confidential. And the money that we get about $4,000 per person that will go back into our community, our state, for every person that fills out the census, that funds programs like breastfeeding programs, like WIC, like Head Start, like REACH. So I just implore you all to talk to your friends, your neighbors, your relatives, and ask them, have you filled out the census? Because that's $4,000 into our pocket. The other thing, I love the hashtag feed, nourish, and love. And as Commissioner Vega Peterson said, it is such a personal experience. And frankly, I had challenges. My daughter's a little bit older, but 20 some years ago, it was challenging and it's stressful. And I was not very successful in breastfeeding. I wanted to. But we just know that there's a lot of challenges, and the more support that you can get, the better. And then the other thing, Linda, I wanted to touch on is that absolutely giving more women opportunities in this field with people that look like you, that have lived experience, and that can come, just with a wealth of knowledge. And I was really kind of disturbed when you said that hospitals will typically only hire nurses to do this work. And certainly, so maybe if you could comment about maybe how can we get more women engaged in this career path? I'd love to hear any thoughts you have on that. Is she still with us?
Oh, yes. I couldn't unmute myself. Okay. So with the REACH program, in year 3, quite soon, they're funding a CLC. So that's a Certified Lactation Counselor training program. So that's one of the first levels that will enable more women in the community to have that lactation specific education so that they can start up that ladder of becoming lactation consultants, but they can still at this level start to deliver needed care to our community. And that will be in a short few months that can be achieved. And I'm just happy that the support is there and that this initiative is around so that we can have this happen for more women in our community that want to deliver these services. And so that's one of the things that the REACH program and BPI as a partner will be doing.
Great. Well, I'm excited to see that work moving forward. And I love the outreach and how, the advertising on TriMet and how I think somebody said that biologically, that's the purpose of breast, is to feed our children. It's we forgot that somewhere along the way. And reminding people is a really important thing. And, with all the health disparities that we know, especially that Black communities suffer from, and we're looking at other ways to help Black and Brown communities, whether it's preschool. This is just one thing that can really help provide more of a level playing field in so many ways. And I love that slide that just listed all the benefits, the health outcomes, the costs, the benefits to society, the benefits to your mental health. I mean, it's just like really, I wish everybody in the world could see your presentation, because it just has been so eye-opening and educational for me. And I want to thank the moms for coming and sharing their stories. And, let's just keep normalizing how important and natural it is to breastfeed our babies. So thank you all so much. Amazing presentation. There's a lot going on in the world, but to listen to you all gives me a lot of hope. Thank you.
Thank you, Commissioner Stegman. I have a question actually for Charlene. I think you all can tell how really moved and this board is by the work that you're doing. And I think it's a pretty remarkable state that we're in, a position that we're in right now, where we have a board of county commissioners of 5 moms. And so we are all just incredibly supportive in the work that you're doing. And I want to know, Charlene, what can we do to support you? What can our board do? What policies can we implement? What do you need from us?
So thank you for the question. We actually have a number of policy that we have identified, and we'll be working through the McFab. Actually, I just had a conversation yesterday with Adele Adams and Bernadette, and we'll be presenting some of those policy forward. So some of those policy may include legislative options, and also looking at some administrative and programmatic work that we can do. And just speaking, some immediate things. So part of it is like designating a dedicated space within the Multnomah building as breastfeeding space, both for once we're no longer in the stay-at-home order. Part of it is also working with employers. We are employers. I think we're definitely positioned as Multnomah County to help and lead the way around, some more and additional breastfeeding friendly policies. Additionally, we would love to work with the board on working with our local hospitals to be designated as breastfeeding friendly hospitals. That would be another phenomenal one. Another policy that we've thought about as well, making breast pumps, right, more readily available to every mom who needs it. So high quality breastfeeding pumps. And then lastly, a piece around economic development. So as we're hosting the training for our certified lactation consultants, we'd love to work with the board, as well as inviting partnership with our coordinated care organization and healthcare centers, right, to hire these certified lactation consultants, as well as looking at how we can, work to pilot leveraging the skill sets of community health workers as well in support of breastfeeding. Some more to come for sure.
Thank you. I knew you would have a to-do list, Charlene, and I appreciate that. This really was, I think Commissioner Stegman said it so well. This was an incredible proclamation, this morning presentation. I'm really honored to be able to support all of you in the great work that you're doing. Both, I want to thank our Multnomah County staff, folks that are working through REACH, and also the partners and community members who came today. I just don't think that we have that we've done enough talking about how important breastfeeding is for the health of our children, and as you all said, it does reverberate throughout the entire community. So the benefits to the baby and to the mom, but it's also to the community. But those of us who have been through it know it is not easy. There is nothing easy about it, especially at first. Commissioner Vega-Peterson shared about how difficult it is at first when you're alone and you don't have the support of family and community, and you don't really know what you're doing. So, but keeping at it and keeping the support there, whether it's at home visits, it's from your friends and your family to help wrap you with the support and the love that you need to continue to do this. So I also just want to reiterate that it's not just improving the health outcomes of people today. This work is undoing, as you all talked about, a legacy of racism, of slavery, of oppression, and the reverberations throughout the next generation. I just think we get these babies who've been breastfed, and then they're going to grow up and they're going to breastfeed their babies as well. And it warms my heart. I had tears in my eyes with those beautiful photographs of the moms and their babies. It was so lovely. So thank you all. I'm obviously a little overwhelmed this morning, but because I love babies so much, and anything we can do to keep our babies healthy, sign us up for that. So Marina, if you would go through the commissioners and do a roll call vote.
Yes, Commissioner Vega-Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafoury?
Aye. The proclamation is adopted. Now, this is another moment where I'm really sad. One of the many moments I'm sad about COVID, because I want to be in our boardroom right now with some babies to hold and squeeze and snuggle. That is the best thing about the work that we do, is getting to see people in person. So thank you all for coming virtually this morning. And now we've come to the end of our calendar, and we have time for board comments on non-agenda items. So I'm going to go through and call on commissioners to see who has any items for discussion. And we are going to start with Commissioner Stegman.
Thank you, Chair. I wanted to wish you a very happy birthday, and I hope you get to do something fun to celebrate. And I would sing, but you don't want me to sing. So happy birthday.
Thank you. Commissioner Vega-Peterson.
Thank you, Chair. Yep, happy birthday as well. You also do not want me to sing, so that we will just say, give you the best wishes. I did just want to acknowledge that this week is the 100th anniversary of the ratification of the 19th Amendment, where women received the right to vote. I watched this week a New York Times play that they hosted called Finish the Fight. It was really the perspectives from Native American, Black, and Latinx women on really when they actually got the right to vote, and how the 19th Amendment definitely didn't guarantee it for everyone. So I just wanted to share that, because I think it gives an interesting perspective that the fight for women's suffrage was a long one, but it actually still isn't done, as there's still people who are fighting to get the right to vote easily in this country. So, but it is something to celebrate. I think it's something, and it underscores more than ever why it's so important that all of us get out there and vote.
Thank you, Commissioner. We know that COVID has changed so much of our daily lives, and especially for this board, it's really harmed and made it put up additional barriers for the public to communicate directly with us. So I would just want to give a shout out to Jennifer Noonan. She submitted some written testimony today. She sent it to all of our offices, really giving her personal story about how the closure of schools and childcare has interrupted her work towards finishing a social work degree. And so if you're listening, Jennifer, I want you to know that we received your message. And as I said earlier, every one of us on this board are moms. We're all working moms. And I think I can speak for all of us when I say that your words will help drive considerations about what we can do as a county for parents during COVID. It's unimaginably tough, and we need to make sure that we are doing all that we can to support parents and families during this time. So thank you, Jennifer, for writing in. And I just want to encourage everyone out there to reach out to us with your thoughts, with your sharing your experiences, because we do need to hear from you. And it's a little more difficult when we can't see people in the regular ways that we did in the past, as we are in our homes a lot more than we ever were before. So thanks again, Jennifer, for reaching out. And with that, we have no further business. So we are going to adjourn, and we will see you next Tuesday at 10 a.m. for a board briefing. Take care, everyone.